Welcome to SVG-TV News for Thursday, April 16, 2020. I am Rochelle Batiste with the details. While some persons have been calling for a shutdown of the country due to the threat of the coronavirus or COVID-19, Executive Director of the Chamber of Industry and Commerce, Anthony Regisford, told SVG-TV News yesterday that any shutdown of the country would be a shutdown of the economy, and this must be carefully examined.
You've got to watch it. It's a dynamic situation, very fluid. A lot of it depends on how long the government can keep the economy going. You get a total shutdown, and of course you've shut down the economy. You know, it's a balancing act. People's health and safety comes first, but I have to add the but. It's inextricably linked to how the economy works. A shutdown will protect or take the steps to isolate and protect people from coming into contact with the virus. But at the same time, it will have an impact on businesses. Businesses won't be able to operate. So it's a juggling act, and it's one that I believe personally has to be driven by the evidence that's before you.
Regisford agrees with the government's economic support measures to help persons in the most affected sectors cushion the impact on their livelihood. He added that small business operators are the majority accessing the banks and credit unions moratorium, as there are hardly any persons taking out loans.
Operate at a lower margin than a big business. A big business may have more of a buffer in terms of their resources. So smaller businesses are having to pull on that, make demands on that service. But they're seeing that those requests coming through. The credit union, which is part of the finance sector, what the credit unions have seen, steady flow in business, not a lot of loan demand. Well, that hasn't peaked. I need to say the banks as well have not seen an increase in requests for loans.
The Chamber of Industry and Commerce Executive Director further stated that financial institutions have reported that many persons have been tapping into their savings since the first case of COVID-19 was announced last month.
But people in the credit union in particular have gone into their savings a bit more. And the speculation is that they've done that to be able to stock up on the items that they were buying, food items. We're talking a 30-day period here. So they've gone into their savings a bit more. In terms of transactions at the bank, they're spread out more. Okay, so they're not as concentrated.
Opposition leader Dr. Godwin Friday has made a suggestion for schools across SVG to remain closed for the remainder of the 2019-2020 academic year, given the current threat of COVID-19. In an interview with SVG-TV News yesterday, Dr. Friday said, taking into consideration several factors, the major one being COVID-19, which has been compounded with the drought conditions, he doesn't believe it will be wise to reopen school anytime soon.
Continue the closure of the school buildings and the congregation of the students in schools. But I hope that some of the schools, I am told, that they are putting measures in place to teach online and to do it remotely. And this is something that I think we have to, the Ministry of Education really has to get up to speed with very quickly. Because even with the closure now for another 2 weeks, to be honest, my view is I don't see them reopening in 2 weeks. And we have to get a situation, because certainly for the Grenadines, you can't maintain hygiene practices without water. And the schools, many of the schools don't have enough water to last them through.
Dr. Friday lauded the government's efforts in moving towards online teaching. However, he said there needs to be fast tracking of teachers' training to administer classes online.
So I hope that the Ministry of Education is feverishly working on that. and that they can, instead of if they can't reopen the buildings and have the children do the traditional way of instruction, that they're able to do so by way of online teaching, by various platforms. You know, Google has platforms, Microsoft, Zoom, all of them. The technology is there. It's just a matter of applying it. You can't just simply have the equipment. You know, if you have a laptop or you have a tablet, that's part of the process. The rest of it, now you have to get the software that allows you to deliver the programs, and then to teach the teachers and the students to use it effectively. It is a, you know, in a sense, it's a blessing in disguise, because what happens is that we now would have to jumpstart that process that we would have to be doing at a slow pace over the course of several years.
Infectious disease specialist Dr. Gerald Thompson is confident that COVID-19 test kits, which SVG received from Venezuela last Friday, are of good quality and must not be rejected solely on the basis of being manufactured in China. Dr. Thompson, who was speaking on the radio, used the opportunity to respond to reports that St. Kitts and Nevis rejected similar test kits. He noted that faulty test kits can come from anywhere, and not because those received from Venezuela were made in China mean that they are faulty.
I find that in the United States, the FDA had developed some kits early on that basically the sensitivity was very low, and therefore you would have a high level of false positive and they had to abandon those tests. Yes, Sam? And you don't want me to come and tell you you're positive, but really you're negative. Or worse, you don't want me to tell you you're negative and you've gone out then rejoicing, thinking that you're negative, and really and truly that test was positive. So depending on the type of kit and how it was developed, and so each type of kit, and there are many of these type of kits, as you try to do different things, the different ways of testing, if I want to say.
The infectious disease specialist said that there are two different ways of testing for COVID-19, which include testing for the virus itself and the other tests for body response in producing antibodies to fight the virus.
One is you are actually testing for presence of the virus itself, the virus particles. You're trying to figure out if that is present. And another type of test, you're testing for the body's response in producing antibodies to fight against the virus. And some of these antibody tests, they sometimes can pick up other coronaviruses. You've heard me say there are some older common coronavirus that give the common cold about, and therefore you could have some cross reactivity with those, you know, and could give you a false positive by mistake, or just that the quality of the test may not pick it up. So you're right, yes, we have to look at CARPHA. CARPHA's focusing mainly on the detection of the antigen.
Dr. Thompson further noted that the test kits received from Venezuela will have to go through stages of validation before they are used.
There's a validation, and so there's where you send the test down to CARPHA, another type of sample on CARPHA to check and see themselves, or that CARPHA could also send you some samples, or some other entity send you some samples, and you don't know what it's supposed to be. It's like an exam, and the more you find out, well, is this negative or positive, or this and that, and you basically have to use the same kits to perform those particular tests and determine, they could rate your lab in terms of how your lab is rated doing this. And there are all sorts of different methods. You yourself have to check yourself, the internal controls and so of how this is done. You know, the same way you have a radio station there, and the technician is going to be coming and checking out the wiring all the time. Here, wait until things break down.
The infectious disease specialist said that no one is really becoming reinfected with COVID-19 after a negative result. Thompson said this may be the result of testing being done too early after patient is free of the virus, or testing kits not being sensitive enough to pick up changes.
In some places, after somebody is positive, they want you to have 3 negative tests. In some other places, it's 2 negative tests within 24 hours. So that if you repeat those negative tests too early, one of them could come up negative, and the first one come negative, and then you do it again, it's positive. But really, one of them was like a false negative. It wasn't that the person went negative and then caught it again in a matter of a day. They were always still positive, but it's just that the sensitivity of the test, the quality of the test may not be able to pick up the diminishing levels of the positive virus.
And persons with diabetes and hypertension have been identified as most at risk to contact the coronavirus. And with this in mind, President of the SVG Diabetic and Hypertensive Association, Rosita King, is advising such persons to take the necessary precautions and follow the advisories issued by the relevant health authorities. King said the organization has recognized the unique threat posed by COVID-19 to persons living with diabetes and hypertension, and that it is important for these persons to ensure that along with social distancing, they have a good supply of medication and take their exercise seriously.
Also, from the association point of view, we'd also like to advise you also to make sure that you have preparation in place. Because you have to make sure that your medication, that you have supplies at least for extra months, that you monitor your blood sugar, you continue daily exercise, and when we say daily exercise, we expect you to do exercise in and around your environment. So you can use inside, you can use your chair. One of the greatest ways of doing exercise is to follow through with your gardening. And because it's important that you have your vegetables and fruits, so we want you to do that. Again, which means you must follow through. Wash your hands thoroughly and regularly. When unable to do that, you use your hand sanitizer, which is about 70% alcohol.
King further noted that physical distancing for persons with diabetes and hypertension is not limited to simply being separated from others.
Because you are at risk, we want you not to share any food or glass or towels or any tools. So things like your needles, your syringes, you should not be sharing them, and you must dispose them properly. Again, one of the things that if you sneeze, you have to cover with a tissue or between the crack of your hand, and you have to clean them. We want you to make sure if there is any problem you are experiencing, and some of the signs and symptoms you will hear, coughing, especially respiratory problems, you are to seek and to call your health district. The numbers are listed and on the registration. You are to call, not to go, but to call your health center to seek further information. Again, you must monitor your blood sugar level. You have to increase your fluid intake, and you must take your medication as prescribed.
In an update on the virus provided by the Ministry of Health, it has been noted that 5 persons who were confirmed with COVID-19 are awaiting their repeat tests for medical clearance, and another 3 persons who were tested for the first time are awaiting their results. This brings the total to 8 pending results. SVG's current figure for COVID-19 remains at 12, of which 11 are active cases and 1 recovered. To date, 88 persons have been tested for the virus with 76 negative results. Meantime, 89 persons were released from quarantine within the last 24 hours. The Ministry of Health is advising persons whose travel documents were withheld due to quarantine and have completed the 14-day period to retrieve their travel documents from the Passports and Immigration Department on Bay Street, Kingston. In reference to the isolation center at Argyle, this is said to be completed and should be officially handed over tomorrow, after which equipment and supplies will be put in place for the facility to become operational. The SVG police force has deemed Easter weekend 2020 one of the most quiet and peaceful in recent years, noting that the public adhered to the COVID-19 advisories and protocols that have been issued by the government. A news release issued today by the Public Relations Department commended citizens for their cooperation and commendable behavior over the past Easter weekend. According to the police statistics, a total of 30 crimes were reported collectively at the 21 police stations nationwide, the Narcotics Unit and the Criminal Investigations Department, CID, compared to 54 in 2018 and 44 in 2019. The police say 2020 figures show a 44.44% decrease over 2018 and 31.82% over 2019, respectively. With respect to motor vehicular accidents reported for the 2020 Easter weekend period, there were 5 compared to 7 in 2018 and 1 in 2019. The police, however, noted that comparative analysis of motor vehicular accident statistics for January to March 2019 to the same period in 2020 shows a reduction of 7.66%. According to statistics from the Traffic Department, a total of 222 accidents were reported in 2019 compared to 205 in 2020. The Commissioner of Police thanked the public for its support and goodwill and urged citizens to continue to work along with the police for a safer and more peaceful country. Executive Director of the National Insurance Services NIS, Stuart Haynes, is appealing to persons to exercise discipline and integrity as it relates to applying for benefits being provided by the NIS to assist persons who are negatively impacted by the coronavirus. During a Facebook Live question and answer session, Haynes said there are benefits for those who would have lost their employment due to COVID-19.
The benefit will cover persons who are laid off without any source of income. But we have to look at this in a holistic fashion because the government has an income displacement program targeted to certain sectors. So one could always inquire about the eligibility under that. And for that program, it covers persons with reduction in income or working hours.
How do you monitor a self-employed person's stoppage of income?
That is challenging. But in a time of crisis, we call in for discipline and integrity. The person will declare that they are unemployed and they suffer a stoppage of income. It's a period of crisis, and we would exercise some trust and good faith in our constituents. So it's basically boils down to one's integrity.
Haynes highlighted what forms are required to be completed for persons to receive these benefits.
Right, there are 2 forms to be filled, and we're going to be flexible with the claiming process. There's the declaration of unemployment form to be filled by the employee, and there's this layoff certificate to be filled by the employer, or a letter from the employer stipulating the workers have been laid off due to COVID is adequate. And we will use that together with the unemployment declaration form and an ID to process. We want this thing to be hassle-free for our constituents.
Physical distancing is being encouraged at this time as part of measures to contain the spread of COVID-19, and Haynes is encouraging persons to make use of the NIS website to access their services.
No, we encouraging and practicing physical distancing. So these forms can be available. These forms are available on our website. Also, you can make requests by way of email, nis@nissvg.org, requesting the forms for the application of the unemployment benefit. If persons so desire, forms can be picked up at the office. But we are encouraging persons to utilize our website or make requests by way of email. And persons who are eligible are asked to provide their banking information.
And in the most recent update provided by the Ministry of Health, of the 8 pending results, 5 of the first-time tests, they returned negative, and 3 follow-ups, they also returned negative.